essential oils, self-massage, change in diet, yoga postures. Discover the advice and tips of our naturopath, Angelica Alcantara, to promote your intestinal transit. Better digest and taking care of intestinal transit, it starts with the meal. It is important to take your time when eating, to chew every bite of food. This triggers gastric juices and other hormonal reflexes, which will aid digestion. Balance your plate and limit certain foods. For healthy transit, food balance is essential. Thus, balance your meals by favoring foods rich in fiber, fruits, vegetables, raw vegetables, whole grains, preferably gluten-free, because even if you are not intolerant or allergic, it is a question of a protein difficult to digest. To avoid gluten, at least after excess for example, while your transit regains its rhythm, legumes, remember to germinate or soak them at least 18 hours before cooking that they are more digestible. Also, if you feel that your transit is lazy, limit the foods that make digestion more difficult: sweets, meat, dairy products, industrial products or ready-made meals, refined cereals, white bread, white pasta, etc. Alcohol and excess coffee or tea do not exceed 2 cups a day, and not after 4 p.m. In order to let the digestive system rest, it is possible to practice mono diet or intermittent fasting. Here is an example of a mono diet to be done over 1 to 3 days. Morning, green juice, or if you're chilly, homemade applesauce served hot, with a little cinnamon, a spice that helps cleanse the digestive system. Noon and evening, unlimited raw apples. If you have a tendency to bloat, remove the skin. If you wish, you can eat them hot. In between meals, herbal teas made with mint, cinnamon, mallow, green anise, boldo, artichoke, chamomile, and lemon balm. For intermittent fasting, to be done once a week, or for a maximum of 3 days, eat in a balanced way during the day, therefore breakfast plus lunch plus snack around 4 p.m., and then, do not eat anything solid, drink only herbal teas, or make yourself a vegetable broth, without the vegetable pieces, or a chicken bone broth for the evening. Then, resume the classic diet for breakfast or at noon. To maintain good intestinal transit, hydration is important. So hydrate yourself enough every day. Drink water regularly during the day, but avoid drinking with meals, as this can tend to dilute digestive enzymes, and therefore slow digestion. If you are constipated, avoid tap water, and prefer water rich in magnesium sulfates, Heper for example. However, be careful not to drink it for more than 3 or 4 weeks, because these waters rich in magnesium can overstrain the kidneys.